Hi, I'm Melissa, a surgical assistant here at Dr. Tom and Mark McCawley's office, and I'm going to go over with you post-operative instructions for the pinhole procedure, also known as PST. I'm going to go over the care package items with you and explain to you what our purpose of the pinhole procedure is. Today we're going to be going up and covering those areas of recession by pulling down the gums using special instruments designed by Dr. Chow. The care package items inside are going to be essential for your healing process. You're going to use a soft surgical toothbrush in all the areas where we do the PST procedure. You're only going to be biting the biting surfaces of your teeth. You are allowed to brush the side surfaces of your teeth, but you are not allowed to brush the gum line. You cannot brush your gum line until you come back and see us for your post-op check appointment. You are also not allowed to floss the teeth that we do the PST on until you come back for your post-op check appointment. Your post-op check appointment will probably be anywhere from about 5 to 6 weeks. The reason being it is this long is because the pinhole procedure is a very delicate procedure and your stitches need to be stayed in place for as long as they can be in order for the gum tissue to not rise up or go back down to where they were once before the procedure. I'm going to go ahead and talk about your diet. So the first night, I recommend a liquid-like diet, no hot foods, as this is going to lead to inflammation and more bleeding. I do recommend soft foods for the next 6 to 7 days, anything such as yogurt, scrambled eggs, cottage cheese, and anything that you can do bite-sized pieces, okay? Be very careful of the surgical areas and do not have anything hard, crunchy, or anything that can get shredded or dislodged in your teeth. Remember, you can't floss your teeth for a few weeks until you come back for your post-op check in the areas that we did the pinhole surgery. Use the chlorhexidine spray or chlorhexidine mouth solution twice a day. Practice good plaque control. Try to floss the other teeth that you are allowed to floss. You can brush the insides of the teeth along the inside, the lingual or the palatal. Always be brushing your tongue. Practice good nutrition as you are going to want to heal quickly. PST does cause slight bruising and a bit discomfort. Ice will be given to you in your care package. You will be using ice for approximately 72 hours after the procedure. For your first night after the procedure, you will have to sleep in a slight inclined position in your bed. You can use pillows to prop yourself up, so please do not lie flat as the blood can rush to your head and cause pressure to the pinhole areas. Gauze will be given to you into your care package. If you suspect any kind of bleeding in the pinhole areas, you must gently lift up the lip in the areas of the pinhole and use the gauze in a very thin horseshoe shaped form and slightly put it near the pinhole areas and then lift the lip back down. You need to apply pressure with your fingers, gentle pressure, and you can even apply pressure with an ice pack. Please avoid lifting up your lip to constantly look at the pinhole sites. The more you lift up your lip and play around with the stitches, the less likely the gum tissue is going to adhere to the root surfaces. So be mindful. Our intention is to keep the gum tissue adhered to the root surface to cover up the recession, to prevent any sensitivity and to avoid further sensitivity for your roots. If you have any other questions, please feel free to give our office a call.